Hello, pet parents. Robert Semro here, and I am joined by Dr. Sue Ettinger, or Dr. Sue, the cancer vet. Dr. Sue, you're here and you're doing some talks on something that's really personal to me. The folks out there, they know Zoe has undergone cancer treatment for mast cell tumors. What are you here talking about? And I've just got 1,000 questions, but I respect what you're doing so much. What are you sharing with the folks here, though?
So I'm here to talk about my new cancer awareness program called See Something, Do Something, or Why Wait, Aspirate. That's the hashtag that we use. And it's a lumps and bumps awareness program for both veterinarians and the pet owner. And the take-home message, if a mass has been there for a month and is the size of a pea, which is half the size of a dime, but so 1 centimeter, size of a pea, been there a month, we want the pet owner to go to the veterinarian, and we can't look at the mass and know what it is, we want to do an aspirate. So why wait, aspirate? But we don't want to just keep an eye on it, or it doesn't feel like cancer. We really want veterinarians and pet owners to be very proactive, stick needles in those masses, it's not painful, and find out what they are. So if a dog has a mast cell tumor or a malignant tumor, we can do surgery, and most dogs and cats will be cured with a simple surgery if we find those lumps and bumps earlier.
Yeah, and I experienced that, and you're absolutely right. That was probably the thing that was most important when I went through it, that early detection and not waiting. I got to the vet as soon as I knew it was not just, oh, when did this happen?
Yeah.
So.
And the reason that this program came about is one of my nurses, one of my veterinary technicians, I had aspirated many benign lipomas, so benign tumors on her dog, and she found another mass, and we all got complacent. We didn't do it for a couple of weeks, and it turned out to be a different malignant skin tumor called a soft tissue sarcoma. And it really hit me hard because this dog came to work all the time. I missed a tumor right under my nose, and I got to thinking, if I'm a cancer specialist and I'm missing them, how am I preaching? So the problem is there's no guidelines out there. So it's great if you can call a cancer doctor and say, what do I do with this mass? But most of us don't know what the right size and the right duration. So again, size of a pea, been there a month, go to your vet and expect them to do something and not just look at it.
Now, cancer is something that scares pet
is.
parents in particular.
Yeah.
I know how upset I was. What do you advise to get past that?
Well, a couple of things. One is you have to learn about your pet's cancer because every cancer is a little bit different, even, and lymphoma in one dog may be different than lymphoma in another dog. But the good thing to know is that most dogs that are treated live longer and they live well. That's another thing I say, live longer, live well. 80% of dogs and cats going through chemotherapy have no side effects. And if they have side effects, it's very mild and it only lasts a couple of days. So, and most people, when they first hear cancer, they freak out and they think, I would never treat. And then, so, the vets in my area, they send them to me, and by the time we talk about it, I'll call them, I'll say, we started chemo today. They're like, what? That owner wasn't going to treat. But as we learn about how well tolerated treatment is, and how the dogs can still go on hikes, and still go to the beach, and still do all their normal activities, most pet owners will rethink it. And it's not for everybody, but again, they don't get sick, and all the things that we think about with humans going through cancer treatment is really not with dogs and cats. They really tolerate it so well. But again, you have to get over that emotional hurdle because most people hear cancer and they shut down. So again, you really want to go to somebody and talk and learn about the individual cancer and then what the treatment entails.
Yeah, and the other thing too is, at least
Yeah.
The alternative of not doing something is worse.
Right.
So I love this. Now, if you could just wave that magical pet wand of yours, what would you instill into every pet parent out there to just change that thinking?
In terms of treating cancer or finding cancer?
Just finding it.
I think pet owners know their pets better than the veterinarian. And so it's great. I think preventative health care is really important, especially as our pets get older. They should go to the veterinarian twice a year. Look at their weight, but really know your pet, feel your pet once a month. I want you to be doing an exam, feeling them, any lumps or bumps. And part of the program is we're going to have little measuring devices, little calipers, and little skin maps. So you can say, I found this mass. So when you go to the vet, we all know exactly where it is because there's nothing worse than the pet owners trying to find it and things like that. So know your pet, keep an eye on their pet, and look for any changes. Lumps and bumps, obviously, but changes in appetite, weight, things like that. And if your pet seems off, use your intuition and go to the veterinarian and don't put your head in the sand. We all want to. But again, early detection for not even just cancer, but other diseases in dogs and cats is really super important.
It really is. Well, and what you're doing is incredibly important. Thank you for all the different efforts. I want to make sure the folks know where they can find out more information about your program.
drsuecancervet.com, and then there's information about the program and whywaitaspirate.com as well.
Folks, go check it out. So important. As someone who's gone through it, I've got to tell you, knowing what's going on really makes it much more manageable and easier to deal with. So thank you for everything
Thank you
you're
for
doing.
having me.
Yeah.
Appreciate it.